Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. More than a decade after electronic cigarettes became broadly available in the U.S., their merits are still being debated. Do these products help people quit smoking? Do they carry serious risks that should not be overlooked? This week, we hear from two tobacco control experts in a two-part series. Part one today features Dr. Nancy Rigotti, professor of medicine at Harvard Medical School. She recently published an editorial about the utility of e-cigarettes for smoking cessation in the New England Journal of Medicine. She shares her views with Dr. Josh Sharfstein. Look for part two next, where we'll hear from another academic expert who's raising concerns about health risks associated with e-cigarettes. Let's listen.
Professor Nancy Rigotti, thank you so much for joining me on Public Health on Call. It's great to see you after a number of years where we have not been in touch, but I certainly remember you as one of my medical school advisors. Really appreciate your being here today.
My pleasure. Nice to see you too.
So our topic is nicotine and electronic cigarettes. And I know you have worked a lot in this area and thought a lot about this. And maybe I just start with a general question. How should we think about the health risks of nicotine as compared to the health risks of, say, cigarettes?
We know that cigarettes are really deadly, that they kill about half of the people who use them regularly, and they're responsible for maybe 500,000 deaths a year. So we know that that's terrible and we need to get people to quit. The interesting thing is that what kills people from cigarettes, what causes the diseases that kill so many people, is not caused by the nicotine. It's caused by the act of combustion, of lighting a cigarette, and that produces many, many chemicals, some of which are carcinogens, some of them are things that cause coronary heart disease, others are things that damage the lungs. So it's the products of combustion that are what kill people, but it's the nicotine that is addictive that keeps people smoking. And so we need to separate out those two. Ideally, people wouldn't use either, but for people who are already using cigarettes and are at very high risk of dying of their habits, anything we can do to get them away from combustible cigarettes, even if it means keeping them exposed to nicotine, is certainly what we'd call harm reduction, substantial harm reduction.
So let's talk about the use of nicotine products to help people quit smoking. That started with the patch and nicotine gum, and now has extended to people arguing that electronic cigarettes may be good to help people quit. What's the evidence on all those products? How do you think about that?
There are nicotine products in two different categories. We have medicinal nicotine products. These are products that have been evaluated as medicines by the Food and Drug Administration and have been determined to be safe and effective to help people quit smoking. And that's the patch. There's a gum, there's a lozenge, there's a nasal spray, and they're all available and prescribed and used. In addition, we have the products of e-cigarettes and some other alternative newer products that came not through a medical marketing process, but rather they came on the market as consumer products. That is regulated completely differently. None of these products have been reviewed by the medicine side of the Food and Drug Administration. They're managed by the tobacco side. And the tobacco side of the FDA, the Center for Tobacco Products, has to decide whether or not something can stay on the market based on whether their public health, in other words, the population-wide benefits exceed the risks. And they are in the process of deciding that of all these different products that are out there. And they have authorized for consumer sale 23 products. So there are 23 types of e-cigarettes that are authorized. Now, it's a little confusing because there are many more e-cigarettes out there for sale, and they're for sale only because the FDA hasn't disallowed them yet. They haven't sort of made the decision. And also because, frankly, there's to some extent a black market of these products coming in.
I appreciate the distinction between the nicotine products that are approved for smoking cessation and the consumer products that are just being sold that might have some value for smoking cessation. Let's talk about each of those in turn. So just briefly, the medical products, those all have been proven to work. How well do they work?
Well, they all nearly double the chances of success in a quit attempt if compared to placebo. So they're not magic bullets. We don't have a magic bullet for smoking cessation, but they're helpful. They're probably not quite as helpful as one of the other drugs we have that's not a nicotine drug called varenicline, but they're very effective. They've been used by millions of people, and they have been helpful.
And do you think that in the future, the FDA should consider allowing much longer use of those products as an alternative to smoking rather than just for smoking cessation?
Well, already the FDA a few years ago put in new rules on what's the information for the public on the product. And what they said was, if you want to use it more than 12 weeks, ask your doctor. And that was kind of their way of saying you can use this as long as you want. They just felt like you should be asking your doctor about it. And so when I teach doctors, I tell them to say, yes, it's fine. It's harm reduction. It's less harmful than smoking. And that's certainly the right way to go.
Got it. So let's turn to the consumer products, the electronic cigarettes. How do you feel about those for smoking cessation?
Well, when they first came out, I was very excited about it because they differ a little bit from the medically approved products because the rate at which they get nicotine into the brain is much more like that of a cigarette. It's very quick. And that's what gives the hit, gives people some of the pleasure of smoking. It's also what makes smoking more addictive. So they're like a double-edged sword. They're probably better than our existing nicotine products, which don't have that same rapid rise in blood nicotine levels that hit the brain and give people some satisfaction. But they, at the same time, could be more addictive. So if people who are not already addicted to nicotine are using these products, they could become addicted and end up with a dependence that they don't need.
Let me ask you about two questions that have come up about the use of electronic cigarettes to help people move off of cigarettes. One is the safety of the electronic cigarettes themselves, because what goes into them is not nearly as heavily regulated, perhaps, as what goes into the medical products that we just talked about. And there are all kinds of flavors, and there are a lot of chemicals that get into people's bodies from using them. How confident are you that the risks are substantially different when you add that all up?
I'm actually very confident that it's much less, far less than what people are exposed to by smoking a cigarette. There's already exposure data. People have done trials to show that there's much less exposure to many of the known harmful chemicals in cigarettes. Of course, my pulmonary colleagues would tell me that it's not safe to inhale anything but air, but it's clearly much less harmful to inhale e-cigarette vapor or aerosol than to continue to smoke cigarettes. There's really no question about that. I would say that that is pretty much scientifically settled. There is a concern about the flavors, but often the concern is more about how they attract people to use products who aren't smokers than about the harms of the product themselves. That said, I do think that when I recommend e-cigarettes to smokers, I suggest that they think about using them not as a permanent replacement, but rather as something that they would do as they would use other medicinal smoking cessation medicines to get off cigarettes. So that they would think about eventually, when they're sure they won't go back to cigarettes, stopping the e-cigarettes as well. And we're starting to find that there actually is a science that's being developed on how to help people get off vaping.
So if I'm hearing you correctly, your advice is if you can move yourself to e-cigarettes, you're doing better. And ideally, you're quitting the e-cigarettes too.
Yes. My advice for physicians is that we do have FDA approved medicinal products, and we probably should be using those first. But we know that many people have tried and failed, and some people aren't ready to try them. And so I think that as a second or backup, that's where we should be thinking about e-cigarettes. They may be helpful. I really think about it as maybe we need to add e-cigarettes to the toolkit we already have. It's not an either or, and that perhaps adding an e-cigarette to somebody who already is using the patch or using another form of nicotine might help people just kind of get over the edge, because there's the effect of the nicotine coming at a more rapid rate into the brain, which might be more useful. But also there's the hand to mouth movement that people have with these cigarettes that they don't get with the patch or the lozenge or anything else.
Got it. So it's not either or necessarily among the different kinds of devices that could be used for smoking cessation. The second question I want to ask you is about dual use, as it's called, use of cigarettes and electronic cigarettes. There is, some evidence that there are a lot of people who use both together. Some people think that that may pose special risks to people. And there's a concern that introducing electronic cigarettes will just lead to a lot of nicotine and other things coming into people's bodies rather than put them on a real path to smoking cessation. Do you have that concern? And how, if you do, can that be mitigated?
Well, it is true that a substantial number of smokers who try e-cigarettes become dual users, use both products. And we know that there's a wide range of how that works. Some people are basically cigarette smokers and occasionally would use a vape, maybe where they can't smoke because they could use the vape instead. Others are essentially people who are vapors or e-cigarette users and maybe have a slip once in a while or go to a party and have a smoke. So there's a wide range of what dual use is. And so when you're trying to measure the harms of that, it's hard because the exposures are so variable. But what I'm seeing in the evidence that is accumulating is that mostly we're finding that dual use is probably more or less the same as smoking, because smoking is so harmful that even smoking one cigarette a day is enough to increase your cardiovascular risk. And so people who are dual using and think that they're somehow having a major reduction in their risk from cigarettes are probably kidding themselves a little bit.
These can be complicated scientific questions. How do you look at the evidence when you're trying to figure out the data on electronic cigarettes, for example?
Well, I try to follow the principles of epidemiology. And when there's a randomized controlled trial, I'll look at that. But there are some questions that don't have that. So then usually some sort of longitudinal study where you take somebody, you measure exposure very carefully at the beginning, and then you follow people over time very carefully and see if the exposure increases the risk of a bad disease. That's kind of the best way to do it. There's a lot of different studies out there. People have put them together into what's called systematic reviews or meta-analyses, but it's complicated to do that correctly, and that often people are sort of mixing and matching things that really don't belong together. So just because something is called a systematic review doesn't mean that it's the truth. People say, well, maybe people are going to start using more nicotine because they can get nicotine from two different sources. But the fact is that our understanding of nicotine dependence is that people are pretty much taking in nicotine in whatever way they're taking it in order to maintain a fairly constant level that they've gotten used to and that their brain's gotten used to. And the data don't show that people are increasing the nicotine intake so far. And I think that the risks are not going to be any greater than continuing to smoke. I think that, dual use, like just plain e-cigarette use, doesn't make any sense for people who don't already smoke cigarettes. And the message that we need to give to people is that if you're going to use e-cigarettes, you need to switch completely. That's really clear.
So I really appreciate this conversation and your perspective. Sounds like you see the nicotine devices in general and e-cigarettes in particular as a possible pathway to help people who smoke cigarettes and are at such high risk for so many different conditions. And at the same time, you're wary of people getting started on nicotine addiction, even through e-cigarettes.
That's right. E-cigarettes, when I first heard about them, I was hoping that they would be the magic bullet, that giving people nicotine and the ability to sort of have something to satisfy the hand-to-mouth way that smokers enjoy would make a huge difference and maybe solve the problem. It hasn't worked out that way, but the data now from randomized trials is quite clear that they are helpful. And frankly, they're more helpful than the existing nicotine replacement products that we have. And so I think we need to add them to our toolbox and have another tool to help people quit.
Dr. Rigotti, thank you so much for joining me today.
Thank you. My pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Cessiri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Cessiri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.